The program. Now, speaking of this, joining me now is Congressman Anthony Weiner of New York, who wrote in a press release, last rites for a public option is a death knell for health care reform. Congressman, these are some pretty big developments. So the Senate Finance Committee has had a lot of weight put on its shoulders, and people are giving it a lot of credibility. Now it's reported tonight that they're not going to come out with a public option. How does that sit with you?
Well, you know, they call the Senate the cooling saucer of our democracy. They're really the icebox for a lot of reforms we've tried to pass. Look, I'm glad the Senate is finally punting this back to the House and to a conference committee, but I think we need to have a public option. Let's put aside the politics for a moment. You know, if you're going to have people signing up for health care, and there's nothing new in the mix, what we have today, we're going to have rates go up and up and up because there's no competition for insurance companies. If there is that option of something like Medicare that they can sign up for, the competition is going to help bring down insurance rates, and without it, there's really nothing that has that effect.
So what are you going to do in the House? I understand that you just will not give up on single payer. Now, I don't want to be negative about this because I'm a single payer guy, too. I mean, I believe in it. I believe that's where they got to go. But this weekend, at this rally, there were Republicans who were saying that they want to put an end to all government involvement in health care. How does that ring with you?
Well, first let me make it clear, you know, some people use single payer as a dirty word, but 47% of all of our dollars go to Medicare, Medicaid programs that people know, and they know that they work. They've got very low overhead. They're very efficient. I think they should be extended to more Americans. But I am prepared to compromise. If my amendment on single payer goes down, then at least we have a public option. We have some choice that someone can sign up for something like Medicare. You start taking away that, and you've got virtually no cost containment. You've got, frankly, the insurance companies getting a lot of new customers, but no real competition to hold down costs. So, look, we might be able to get something passed, but we've now watered it down so far that the Senate bill might not even be worth passing at all.
Well, at the rally this weekend here in Washington, D.C., this is what I was talking about. This is Congressman Price talking about getting rid of all government health care. Here it is.
We will not rest until we make certain that government-run health care is ended.
You said on the stage that you want to end government health care. Do you support privatizing Medicare?
See, what government-run medicine does is forces people to have other individuals besides themselves and their families making medical decisions. And that's what's wrong, and that's what the American people don't want.
Can you please answer my quick question? Do you support privatizing Medicare? You said on the stage that you want to get rid of government-run health care. What's the difference between Medicare and the public option?
No, what I support is allowing patients to make independent medical decisions.
So you support the government health care wins Medicare?
What I support is patients making independent medical decisions.
Now, Congressman Weiner, are governments going to be making the health care decisions, or patients and doctors going to be doing it? Because I think that the Democrats might be losing this argument at this point, even though the majority of Americans want the public option. Your thoughts?
Well, look, I think that we all need to realize we all have a single payer. Some of us an insurance company, some of us have Medicare or Medicaid or the Department of Defense or Veterans Affairs. Look, the bottom line here is that under Medicare, you get to choose your doctor, you get to choose your hospital. The only question is you don't get the 30% overhead and profits that the insurance companies take. The Republicans have tied themselves into an intellectual knot here. On one hand, they say they're opposed to government-run health plans and they're opposed to single payer, and then they thump their chest every year about how they're trying to protect Medicare. The fact of the matter is they didn't like Medicare when it was passed. They don't like it today, and that makes them in the distinct minority in this country because people who have Medicare say they like it.
Congressman Weiner, thanks for your time tonight. Appreciate it very much.
Thank you.
For more, you bet.